Welcome back. Seniors in Singapore now have an additional option to age well in their communities by sharing apartments with other elderly residents while being supported by a team of live-in caregivers. The Health Ministry has given the green light to this new care model for seniors who prefer community living over institutional care. Nadine Yeam finds out more.
84-year-old Mr. Peter Lai has been staying in this assisted living space in Henderson for slightly over 2 years. He was part of the pilot or sandbox phase, where seniors share a home and receive support from live-in foreign caregivers.
因为他们没有人来看他，比较孤独这样，那我就跟他谈哦，谈一下不用伤心，我们跟他解释一下，家人很忙，所以没有来。
Under the shared stay in senior caregiving services model, caregivers provide help similar to what seniors would receive at home. They must either have prior experience in caregiving or have passed mandatory training courses set by the agencies. Medical and nursing care will not be part of the scope. Operators are also expected to provide status updates to their residents' next of kin on a regular basis, so their families will still be involved in their caregiving. For one company, the key is ensuring quality care for its residents.
Number one is, of course, training, because in the context of the various agencies, they want to ensure competency before they attend to the elderly. So training is definitely one of the components.
Previously, a total of 5 operators were included in the sandbox phase. Now, with the mainstreaming of the model, more companies are invited to apply for work pass flexibilities, like additional foreign worker quotas and more options to hire from other countries. Up to 90% of the training fees could be subsidized for companies sending their caregiving staff for relevant training courses. An industry-led practice guide has also been published to offer guidance to companies, seniors and their families on client suitability, service scope and recommended caregiving practices. As more caregiving options get introduced, Health Minister Ong Ye Kung says the biggest challenge would be ensuring the smooth transition of seniors from one care setting to another.
So when that happens, we must do our best to ensure that the process is smooth, the process is seamless. A senior's health condition, for example, their drug allergies, the medications that they are taking, must be known to the new care provider even before the senior arrives. Otherwise, care will be compromised. So this ball, we must try our best not to drop it.
The Health Ministry will lead efforts to drive the integration process forward, including introducing new IT systems to coordinate the delivery of care. It will also table the Health Information Bill in Parliament in January next year, which will enable the sharing of patient data across care settings.
And for more on this, we speak to Dr Kelvin Tan, who is a senior lecturer in gerontology at the Singapore University of Social Sciences. Dr Tan, welcome to the show.
Thank you.
Now, the pilot started out as a sandbox in 2023. Now, from your perspective, why do you think MOH and the sector felt that within 2 years, it was ready to expand it and roll it out?
Well, I think Singapore is entering a very new era. We are entering the super aging era next year. So it's good news to everyone that MOH has new initiatives and rollout like this. After doing sandboxing for 2 years, it's probably a very good timing to understand the nuances that's required for inter-government agencies to get together and provide these services. And around that same time, there was this company called Red Crowns that provided some sort of support to pool services for older persons. So I think it's good timing.
Yeah, so in this case, why do you think this shared stay-in caregiving model is so appealing to families compared to these other options, like, for example, hiring a lived-in helper or maybe hiring home nursing services?
Yeah, I think the difference between live-in helper and the other existing services is that it gives a kind of flexibility to the family members. Well, living in Singapore, I think we are very fortunate that we do have more spaces to sort of co-live with a stranger of sorts, a foreign domestic worker. But there are families who think that during certain time of the day, they can actually manage the care of the older person. But there could be time where, because they need to work, they are busy, and the shifts of the work doesn't allow them to provide the quality of care for older person. And I think this is just wonderful. It gives them that option. It could be cost effective also, because sometimes, I see families having foreign domestic worker, and they have to think jobs for them. Whereas when you have live-in sort of carers like this during night time, and then he or she goes off, the family takes over. So it's great.
Yeah, but how does this model differ then from simply having trained nurses or caregivers in their own homes?
Yeah. So nurses provide a certain function that clinical related, like wound care and some intubation services, for example, which requires very trained professionals. And today, our foreign domestic workers at home do the domestic tasks, right? That's how it's defined. So there is a gap. And this gap is someone who can be more professionally trained, goes through the right sort of curriculum, and can address the gap between these two different services.
Which group do you think then, Dr. Tan, of seniors are most suitable for this kind of care model?
Well, I believe in an aging society in Singapore, the life experiences and the communication is very important. They like to talk to somebody who is professionally trained, understand the cultural nuances of Singapore versus other countries. So when it was mentioned here about there will be support for up to 90% for the training, I think it's very important, because the training plays an important part that functions well for the living caregiver who's going to be in family.
Yeah. When deciding between hiring a stay-in caregiver or shift-based support, how do you decide which setup is safer and more suitable for the particular senior that a family is taking care of?
I think it's difficult to say, to be very frank, because every family has its different needs, and they will have to make a choice based on the interview they conduct with the potential live-in carers, and if they could actually have this option to exercise the recruitment process together with the service provider, the family will make better choices. And there's possibility that families' needs for their care of their older person will grow over time.
Yeah, you mentioned training earlier, Dr. Tan, and with the new training subsidies that are going to cover 90% of the course fees, do you see potential improvement or uplifting of the quality of care that's being provided by these caregivers?
Certainly, the first thing that hit my mind is, it will attract better quality services because it lowers the cost of business, right? So more private operators who are interested to get into this arena could actually, lower their cost of operation by having subsidy from government. And at the same time, they can hire and attract more people to come because of the training element. It means professionalism. It means sensitizing the needs for Singapore, which is very different from different countries because of our cultural needs and ethics and languages.
Yeah, well, this model allows care to be given within the homes of these seniors. So having that embedded care, what kind of benefits, but also challenges, do you see and anticipate might come up? And how would you resolve them?
Well, I see more benefits because I see options provided means that more providers on care services will be in this sector, offering a wider range of services, higher quality of support. So the family will actually embrace this new initiative more and therefore cooperate together. No new services can actually be perfect in day one. It needs time, and as we find and we are open-minded about different type of models, the family will cooperate together and make this a success.
Yeah, this is definitely at least starts giving more flexibility and extra options for caregivers.
Certainly.
Dr. Tan, thank you so much for sharing your insights with us. I've been chatting with Dr. Kelvin Tan, who is a senior lecturer in gerontology at SUSS.